I'm Casey Briggs. With another coronavirus upswing underway in Australia, how much difference will this week's expanded eligibility for fourth vaccine doses make? We'll look at that with a panel of experts in a moment. We'll never know precisely how many new cases are being contracted a day, but we are pretty confident that number is climbing in all states and territories. Average daily case detections are back above 35,000. And in just 1 week, the number of people in hospital with COVID has grown by about 800 to around 4,000 people. The peak in January, it was about 5,400 people. We're yet to see a lift in deaths corresponding with this week's spike in hospitalisation. Average daily reported deaths have fallen a bit this week to about 42 a day. Let's take a look at vaccinations. About 54% of all Australians have had a third shot. Remembering this includes children who aren't eligible for a booster. And demand for third doses, well, it's been markedly lower than it was for second doses. Many of the people who are triple vaxxed are about to become eligible for a fourth dose after a decision by the nation's expert vaccine advisory group this week. ATAGI now says a fourth dose is recommended for people over 50, while people aged 30 to 49 are able to get one as well.
Well, I think health authorities across the country are becoming increasingly concerned about what is a third Omicron wave just for 2022. Case numbers are rising, hospitalisation numbers are rising quite dramatically, and we've probably still got several weeks or a couple of months to go. So we are committed to doing everything we possibly can to get Australia through this winter safely. We've extended funding arrangements to the states to help support their hospital systems. We're rolling out information campaigns to encourage Australians to get up to date with their booster shots. And as you say, yesterday I accepted the advice from the technical advisors on immunisation to expand eligibility for that fourth dose to people over the age of 50 in particular, because we know they're at particular risk of severe disease.
Let's get more on this decision with epidemiologist Maru Sheil in Sydney and Cyril Cohen from Tel Aviv's Bar Ilan University. Israel's been administering fourth doses to some of its population for much of the year. Associate Professor Sheil, Dr. Cohen, welcome to The Virus. Professor Sheil, I might start with you. What's the evidence say at this point about how much protection a fourth dose gives you?
Yeah, hi Casey, thanks for that. So we do know that as you can imagine, every dose of the vaccine will have an incremental benefit to your immune response. What we know is that the fourth dose will again provide extra immunity, especially in those who have maybe had 3 to 4 months since their third dose. And it will probably boost it from about, I guess, to not so much around the symptomatic infection, but also predominantly against severe disease. So that's really what it is. And the evidence is stronger for, again, the elderly population, where we know who are highest risk of contracting the disease and having severe outcomes, so hospitalization and death. So the evidence is, we know that every dose adds in. So we're still learning about the evidence against Omicron, and particularly around BA4 and 5, which are the new strains, Omicron subvariants that are causing the new wave as well, or dominating the new wave.
And Professor Sheil, a lot of people in Australia have had COVID by this point, and many of them have had it quite recently. Many might be asking themselves, if they've had COVID recently, should they get a fourth shot?
Look, I think that's a really good point. And what we do know is that this idea of hybrid immunity, so when you had a combination of vaccine-induced immunity and natural infection from SARS-CoV-2, you get a really good immunity against, at least we saw that with Delta, but we also saw that with the original Omicron strains. What we don't know is how that hybrid immunity pans out with these new variants, the BA4-5, and that's really the unknown, which is kind of why the ATAGI advice has come around to the fourth dose, particularly against the elderly population. So yes, we've had a lot of natural infection. We have high dose coverage for the primary course, so the first and second dose of the vaccines. So overall, that does give people a significant immunity, but we don't know whether that immunity is going to be protective against the new variants. And that is probably one of the reasons for the ATAGI deliberation as well.
Dr. Cohen, to you now. Israel's been giving fourth doses to high-risk individuals, people over 60, people in high-risk occupations for some time now. What's been the impact of that?
Yeah, so basically, hello, Casey. So basically, we've been following that for now, I would say 6 months. since we started to administer that fourth dose. Basically, what we have seen is that there is a benefit for the elderly, at least at the short term, in terms of, I would say, the possibility to reduce the severe disease by a factor of 3 or 4 compared to people that got 3 doses. I would say in the same at the same time. So these are good news, but we don't know to what extent it will provide a long-term protection compared to 3 doses. And the second thing is what we are trying to determine is what will be the protection when we are facing those new variants that were just mentioned by my colleagues, the BA4, BA5. But definitely the benefit is for, I would say, severe disease, and the benefit is for the elderly.
Israel's been, I wanted to know, Dr. Cohen, what the take-up of these doses has been like. In Australia, we've seen, fewer people getting third doses than have got second doses. Is that the same situation there?
It's exactly the same. I would say that for a population of 9 million in Israel, and I'm including, of course, the children. So for the first dose, around 7 million people got their first dose. If I'm moving to the third dose, we add around 5 million people, which would represent, it's almost the same numbers that you mentioned in Australia. And for the fourth dose, only 800,000 people, meaning that it would be a little bit less than 10% of the Israeli population decided to get that. From the numbers we have, it represents more or less 50% of the elderly, 50% of the people over the age of 60 decided to go for a fourth dose.
So I guess that's at least the high-risk groups being more covered. Associate Professor Shiel, the vaccines we've got at the moment, they're not Omicron-specific vaccines. We're still talking about the original formulations. If and when, those Omicron variant vaccines do get approved, is it likely that they'll be recommended as well?
I think so. I hope so. I think that's definitely a realistic goal now, and we're likely to see some Omicron-specific vaccines. Also, variant-proof vaccines as well are under consideration, and I think that would be a real consideration. And of course, we've got to keep an eye on what is actually happening with the new variants evolving. We have seen a pretty fast-paced evolution of some of these variants, so I think that's a realistic approach. But that is not, I guess, imminent anytime soon, and Australia is going into its winter wave or winter season, which of course increases the risk of transmission. So in the meantime, the current version of the vaccines is what we have, and I think the elderly population, the high-risk groups, as recommended, should get their fourth dose.
Should we stop even numbering these doses, your third, your fourth, your fifth dose, and maybe we just need to start thinking about it soon as your annual COVID shot?
Potentially, it's looking like it's going to be around, is it an annual shot or is it a winter dose, as we're calling actually the fourth dose is the winter dose, potentially, because we're also constantly changing. The advice is constantly changing based on the evidence that is coming out and what it takes to stay updated. So I think that agility and adaptability is definitely needed, yes.
Dr. Cohen, Australians casting a wider net for eligibility for these fourth doses than you have in Israel. Anyone over 30 can get them from next week. Would you like to see wider eligibility where you are?
Yeah, no, basically, it's almost the same situation. It was recommended or actively recommended for people over the age of 60, but anyone over the age of 18, more or less, was able to get a fourth dose if he desired to. Basically, what the guidelines were that if you are in contact with someone, in the elderly population, you would be eligible. So meaning, basically no one checked if you wanted your fourth dose. So basically, I don't see any major difference. I think that the only thing is that we believe, based on the evidence we had in Israel, and I'm saying that as a professor in immunology, based on what we have been following in Israel, the benefit is mainly for the elderly because the benefit is mainly for severe disease. Severe disease is quite rare, especially at the era of the Omicron for people that are young and in good health. So there is no, I would say, incentive for that population to get a full shot.
Associate Professor Marie Shiel and Dr. Cyril Cohen, thank you for your time.
Thank you very much.
Well, we know the daily COVID surveillance data has never been perfect. If we want to know the overall number of deaths due to this pandemic, we need to look at deaths from all causes to capture any COVID deaths that could have been missed, as well as any deaths that weren't necessarily a direct cause of the pandemic, but for which the pandemic was a factor. The Actuaries Institute in Australia has produced an analysis of those excess deaths. Here's what it shows. This is their model of how many deaths we'd expect to have seen if there hadn't been a pandemic. You can see there's always a seasonal effect. Australia records more deaths in winter than in summer. Now, let's add in the actual number of deaths that were recorded through 2020 and 2021, where deaths tracked normal patterns or even came in a little under the expectation. But in the first 3 months of 2022, we've seen that spike linked to the first Omicron wave. Jennifer Lang led the group that produced that Actuaries Institute analysis, and she joins us now. Jennifer, thanks for joining us. How big is that lift in mortality in the first part of this year, and how have you calculated it?
So the first half of this year, what we've seen is around nearly 8,000 extra deaths. So what you can see on the graph is around 5,000. And then we've added in an estimate of how many deaths we expect just from COVID in the second quarter of this year to get to that 8,000.
Do you actually go about calculating numbers like that?
So what we've done is we've built a model, as you can see, for the expected deaths over the period. And we just look at the age distribution of the population, the size of the population. As we have more people in Australia, there's more people likely to die. And then we overlay that with a little bit of expected mortality improvement to get an expectation based on previous patterns of death. And then we look at the actual and have a look at the difference between the two to get a sense of the overall impact.
You say about 8,000 more deaths we've seen this year than we would normally see. Can you put us into context, how big is that number? Do we have any recent history of spikes that high?
Not that high. So the most recent we've had, the worst flu season we've had in the last 10 years was 2017. And in that year we had a spike of probably only about 20% that high. So we had more flu deaths than we'd expect. But so far this year we've had 3 times the excess deaths in 2022 than we had in the whole of 2017. So it's definitely a lot worse.
And Jennifer Lang, you've also done some work looking at how COVID-19 compares to other causes of death. In 2019, some of the leading causes of death were heart attack, dementia, cerebrovascular diseases, flu and pneumonia. That was the 9th leading cause of death back then. How are we looking this year?
So what we're seeing this year is that we expect, so far this year in the first half, we expect that COVID-19 is going to come in number 3, so it'll be the 3rd highest cause of death this year. And 2019 was actually one of the worst flu and pneumonia periods, not quite as bad as 2017, so normally it's even lower than 9th. So this year it's low again so far. We've only seen 50 deaths or so this year from flu, and we don't expect it to be in that top 10 this year, this half.
This is a crystal ball question, so it may be difficult to answer. But as we look at how Australia moves from a COVID-free strategy to what we have in 2022, do you think this peak, this spike in overall mortality in Australia will subside, or is there a chance that we just continue to record these excess levels of death as long as we have the novel coronavirus?
I think as long as we're continuing this current level of cases, we're going to continue with the current level of deaths, would be my expectation. And it's not an enormous increase in mortality. It's probably a 10% increase, but it's more than we've seen, as I said, for the last 10 years as a spike. So it's definitely worsening the mortality so far.
So that would suggest, and I know you're not a public health professional, so I won't ask you to give your public health advice here, but it would suggest that if our aim is to minimise excess mortality, not necessarily of any particular cause, but overall mortality, we're not necessarily doing that at the moment.
Well, as you can see from 2020, when we kept out flu and other respiratory diseases, we had really low mortality. We actually had 4,000 less deaths that year than we'd expected. And so the more we can minimise the spread of diseases that might cause excess deaths, the better the population mortality will be.
How do your calculations and your model, how do we compare in Australia, on the international sort of stage when it comes to this sort of measure?
So for the first 2 years, we were much better than the rest of the world, as I think we all know, that keeping COVID out was great for the population mortality. But for this, certainly so far in 2022, we've been about the same as the countries we normally compare ourselves against, so neither worse nor better, I would say. Jennifer Lang from the Actuaries Institute, thanks so much for your time. Thanks very much, Casey.
And that is The Virus for this week. Thank you so much for your company. Bye for now.